Parents of a 3-month-old baby are worried about cot death. What advice would you give for baby's position while sleeping in cot? The advice in UK is that all babies should lie on their back with their feet touching the foot end of the cot. It's called back to back. Baby born at 36 weeks gestation develops difficulty in breathing with intercostal recessions and nasal flaring few hours after birth. Temperature is normal, but mother had prolonged rupture of membranes 48 hours ago. What is the diagnostic test? We are suspecting neonatal sepsis, and blood culture is the most appropriate diagnostic test. An X-ray may or may not show changes of congenital pneumonia, and other tests are no longer indicated. 6-month-old baby is admitted with irritability, lethargy, and is not feeding as well as usual. Temperature is 38.3, resp rates 30, saturations 97%, and cap refill is 2 seconds. Urine reveals leukocytosis on dipsticks. What is the diagnostic investigation? So you are suspecting UTI in the 6-month-old boy, and the diagnostic test is urine for culture. There does not appear to be any other focus for infection, and the gold standard test for UTI is not urinary dipstick but a culture. 4-month-old boy with confirmed UTI undergoes investigation which reveals vesico-ureteric reflux. What would you tell his parents? All young children with VUR require long-term antibiotic prophylaxis. Some of them may need surgery later on if they do not resolve on their own, but that's generally undertaken after a few years. Yes, some of them may have kidney scarring, but not all. 2-month-old boy presents with recurrent projectile vomiting and dehydration. During a feed, you notice a mass on the right side of abdomen and also a peristaltic wave. What investigation is most appropriate? You are suspecting a pyloric stenosis. An ultrasound abdomen shows a thickened and elongated pylorus, which confirms the diagnosis, and a referral could be then sent to surgeons. 7-year-old girl is brought by mother with persistent PV bleed. She also gives a history that her daughter recently started taking horse riding classes and fell on her bottom. What is the single most appropriate next action? We have a history of trauma, and if the bleed is persistent, she needs to be examined under general anesthetic. 4-year-old girl is brought by mother with PV bleed. She also has fingertip marks on both thighs, but there's no explanation of these marks. What's the single most appropriate next action? This is suspicious because of unexplained marks, and you need to inform Child Protection Services and initiate the process. 7-day-old baby whose birth weight was 3.5 kilograms is now 3.4 kilograms. What is the most appropriate next step? Slight weight loss is common after birth, and most babies would regain their lost birth weight by 7 to 10 days or up to 14 days. So continue regular childcare if the weight loss is not excessive. 7-day-old breastfed baby whose birth weight was 3.5 kilos is now 3 kilograms. What is the most appropriate next step? This baby requires a pediatric referral for assessment, as the weight loss has been excessive. Most newborn babies will lose 4 to 6% of their birth weight by day 5 and would regain by day 10. If the weight loss is more than 10% of the birth weight, which in this case would be more than 35 grams, in this case would be more than 350 grams, a referral to pediatric services would be required. 12-month-old child with AIDS is now due for the MMR vaccine. What is the single most appropriate action? It is a bit tricky question here because we have said this child has AIDS and not HIV. So we cannot give a live vaccine to someone who is fulminantly immunocompromised. We can still proceed with normal vaccinations except BCG in a young child with HIV positive result. But if they have developed AIDS, then we cannot give live vaccines.